Hi there. I want to introduce myself. My name is Holly Biola. I'm the Chief of Family Medicine at Lincoln Community Health Center here in Durham, North Carolina. And today we're going to talk about how and why you should consider self-monitoring your blood pressure at home. I first want to make sure we're starting on the same page about what the numbers mean, what blood pressure actually is. I tell people that if you sort of were to take a tire gauge and push it up against your body to get a sense of how much pressure was in there when the heart wasn't beating, just when things were still, that's what the bottom number is. The diastolic blood pressure, the bottom number is kind of the number, the amount of pressure that's in you just at rest without the heart beating. The systolic number, the top number, is the amount of force that's pushed out of that heart with each beat, that jet that is pushed out into your body with each beat. That's the pressure, that's the top number, the systolic. And one of the important things I want to point out today is that every single beat of your heart, you will get a different reading slightly than the last beat because it's different. You might have had a breath, you might have had a thought, something's different than it was the last beat. So it is normal when you check your blood pressure at home to have it be different. And one of the reasons it's so great to have your own blood pressure monitor is you can get a sense of your range instead of just taking that one value you're given at the doctor's office every 6 months or 3 months. You'll know what your range is, where you usually fall on your systolic and your diastolic blood pressure. Why do we care about what our blood pressure is? Well, I like to think of it like gardening, taking care of your body, and your blood is sort of watering your body's cells, among other things. When you are watering delicate flowers, you want to sprinkle the water over them at a pressure that's reasonable. You don't want to blast those flowers with a fire hose or they will die. It's the same with your blood pressure. You want that blood pressure to be at a reasonable level so that it's properly feeding and watering all of the cells in your body and not blasting them and damaging them. So if those delicate little cells in your body at the tips of things, the ends and edges of things, get blasted with the fire hose of really high blood pressure over time, what we see is damage to the little tiny cells and delicate parts of your eyes, your brain, that's strokes, and other problems with your brain, heart attacks, heart failure, kidney disease, kidney failure, and erectile dysfunction. You really want those delicate cells to get the appropriate amount of blood pressure over time. So when you do look at home with your own blood pressure cuff and you get those numbers, those readings back, what are you to do with those readings? Well, at Lincoln, we give out this, we call it the rainbow card, just to show that you want your blood pressure to be under 120 on the top, if possible, under 80 on the bottom. That is a perfect blood pressure for keeping everything well served and not beat up. When you get into the 130s and the 80s, we start to ask, could you eat less salt? Could you maybe go for more walks? Maybe lose a little weight? What can we do to bring that down? Just a little bit. When you get into the 140s and 150s, over 90s or above, that's when we start to talk about medicine and say, we really need to make a change here or we're going to see damage over time. But ask your doctor if you're at Lincoln or your provider about getting a rainbow card, about getting one of our rainbow card also happens to be on our log. So ask for a blood pressure log next time you're in. What kind of blood pressure monitor should you buy? So if you are buying your own blood pressure monitor, first check if you have health insurance to see if they cover it. Health insurances now, since COVID, are covering a lot of blood pressure monitors because they want you to be able to have the ability to check at home. There is a website called validatebp.org run by the American Medical Association, and they check to make sure these devices work and they list the ones that do. At Lincoln, we've been using the Omron 3 series, and I want to stop the share for just a second to kind of show how it works. There's the part that does the reading, and there's the cuff that goes on your arm. This little tubing, if I can make myself figure out which way is which, this little tubing is connected to something called an oscillometer. The back of this little gray part is the part that detects whether there's blood rushing through that blood vessel or not. So you want bare skin to be on the part that's with the gray knobby thing. The little gray oscillometer, the little spot that detects your blood pressure, needs to be above the bend in your arm. and it needs to be on bare skin. So I'm going to put this on a little later and show you how to use the blood pressure monitor. So first, I just want to finish this discussion. When you check your blood pressure at home, you shouldn't be talking, you shouldn't be checking email, sending Instagram posts. You should be taking deep breaths. That deep breath actually pushes on your heart a little bit. It actually pushes on sort of a reset button, the sinoatrial node, and helps you to calm down, helps you to lower your blood pressure. When you sit, you want to be seated in a chair with a back on it, so your back is supported. You want to have, as we discussed, the little sensor should be over your bare arm, bare skin. You do want to have an empty bladder because having to hold it increases the amount of pressure in your chest and thus in your body when you're checking your blood pressure. Keep your legs uncrossed and keep your feet flat on the floor. Your arm and your cuff should be at about heart level, which, as we said, is a little bit above the crease in your arm. And how should you be doing this? So the recommendation is to check your blood pressure twice, 1 minute apart, twice a day. So that's get up in the morning, sit down, check your blood pressure, take a couple of deep breaths, check it again. Have your normal day, get home at night, sit down, settle yourself. If you don't, you'll notice that your blood pressure is much higher than you expected. So take a moment, settle yourself in the chair and check again. It's comforting, a lot of us feel, to know what it takes to lower your blood pressure. And that's one of the empowering feelings that being able to check your blood pressure at home will give you. You'll start to understand what affects you, what makes it go up, what makes it go down, and how you can do those things that make it go down a little more often. So when you record your blood pressure, like I say, we give out these little one-page logs, but you can write it in any notebook you want, keep track of it any way that you want. It is helpful to have at least a week's worth, at least 7 days of some morning blood pressures and some evening blood pressures. They don't have to be consecutive days if that's not convenient for you, but a week's worth of readings, 7 days worth of readings, is helpful for you and your provider to understand where your blood pressure normally ranges. I have some patients, actually one of them has a wonderful video on this same YouTube channel. I have some patients who can tell you, well, if I put gravy on my biscuits, I can see my blood pressure go up. Or if I have that third beer, I can see my blood pressure go up. They know exactly what makes it go up, what makes it go down. If I can get over 8,000 steps a day, I can get my blood pressure to my goal. But if I stop doing that, it goes up. Once you start understanding how those lifestyle changes affect you, you may be more likely to do them when you have that feedback. But so keep 7 days at least worth of data. Bring that with you to your next provider appointment, or drop it off for your provider if you just want them to see it. It's really important to do this, especially after you make big changes. Say you stopped drinking, you stopped smoking, you lost 5 pounds. It's worth knowing what that did to your blood pressure. Say you started a new medicine, or you stopped one because you thought it was giving you a side effect. When you make changes like that, you want to know what it did to your blood pressure to know if it's important to make a change before you wait 3 months for your next provider appointment. This is one of the patients that came to our blood pressure class in 2019 prior to COVID. And we were able to see that he was higher than he wanted to be. And after adding a new medication, he went way down, much more towards goal. This is another patient who came to our class. He was getting readings 210s over 110s, and kept coming to class, kept learning about how to eat better, exercise importance, taking his medications. And by the end here, he was getting his last blood pressure on this list is 110 over 66. And I asked him what he did, what medication he started. How do I get some of that for my patients? And he said, all I did was what we talk about in this class. I've just tried to live healthier. You really can take control if you know what you're up against and you start to understand what affects you. So I want to invite all of you to get started now with eating healthier. That's more vegetables, less fatty foods, less salt. Do keep track of your blood pressure, lose the weight if you need to, keep your sugars under control, stop smoking, talk to your doctor about this at your next appointment, and consider managing your blood pressure. So I just want to show, here is my blood pressure, 113/77. After I was seated with my back supported and my arm at heart level and everything's as it should be. So now my arm below heart level, I've got my back is slumped and not supported and my legs are crossed. Should drink some water, talk to you while I do this. Oh, got 138/92. So same person sitting here, just not doing it with good technique the second time. Happy blood pressure checking, everybody.